Dear students, welcome back. In the previous session, we have discussed about patella, isn't it? Yes. Now in this session, we are going to discuss about another long bone which is present in the lower limb, that is tibia. So the other names for tibia is shin bone or shank bone. Okay, both are same, and these are the other names for tibia. Okay. This tibia is also derived from the Latin word which means shin bone. Normally, tibia is present in the is present as a medial bone of the leg. It extends from knee to ankle and it is felt along its whole length on the anteromedial aspect of the leg. And it is homologous with the radius which is present in the upper limb. Okay, and this bone is also divided into three parts. One is upper end, lower end, and the shaft. Okay, so these are the three parts of the tibia. Okay, how can you determine the side of the tibia? Normally the upper end is broader and larger than the lower end. Upper end is broader and larger than the lower end. Okay, if you see the medial and lateral side of the bone can be distinguished by its lower end. So which one is medial and which one is lateral by seeing its lower end. The end has prominent downward projection. The lower end having prominent downward projection called as medial malleolus on the medial side. Here the malleolus means small hammer-like, a small hammer-like structure which is located on the medial side. Okay, that means upper end is broader and which is larger than the lower end. On the medial aspect you can find medial malleolus. With these two factors we can't identify the exact site, because if you turn this bone to the other aspect also, then it appears to be on the medial side. So the another important distinguishing feature which can identified which side, which can be identified as which side. If you see the anterior and posterior aspect of the bone, then only you can identify whether this bone is related to right side or left side. If you see the anterior and posterior aspect of the bone, here the shaft is having triangular in section and has sharp anterior border. So on the anterior side it is having sharp anterior border. The shaft has sharp anterior border, and it is also in triangular shape, and this prominent border runs down from prominent tibial tuberosity. Here you can find the tibial tuberosity in its upper part. So that means the anterior aspect is having two important features. One is the prominent anterior border which runs down from the prominent tibial tuberosity. Okay, so with this we can find that this is the anterior surface. To the anterior surface, okay, you have to place the bone, this anterior tuberosity, in the anterior aspect of the bone, then check for the medial malleolus. So then if the medial malleolus is present on the medial side, then it belongs to the side of that bone. So this is the right tibia. This is right tibia anterior aspect. Okay, so first hold the bone, okay, and see the anterior border first, okay, and also check for upper and lower ends. If place the upper end which is larger on the top and lower end below, and check for the anterior border, so which is very prominent on the anterior aspect, and also you'll find tuberosity on the anterior aspect. So hold the bone like that and check for the medial malleolus. If this malleolus is present on the medial aspect, then you can identify the side of the bone, whether it is right side or left side. So this is the determination of the side of the tibia. Now we will move on to the features. So features of this bone. So first we will see the upper end. So normally this is a long bone, so it is having an upper end, shaft and lower end. Now first we will discuss about the upper end. The upper end of the tibia is markedly expanded from side to side. So here if you can see, this is very much expanded from side to side. Okay, yes. And to form two large condyles which overhang the posterior surface of the shaft. So here you can find the condyles here on the medial side and the lateral side. So that is, it is having two large condyles which overhang the posterior surface of the shaft. So here if you see the upper end, this upper end includes medial condyle, lateral condyle, and you can also find the intercondylar area or eminence, we can call it as, and in the upper end anterior aspect you can find the tuberosity. Okay, so these are all the features of the upper end of the tibia. Now we will discuss about each of them. So we can move on to the superior aspect of the tibia. Then you can understand the condyles as well as the intercondylar area as well as the eminence. Okay, eminence is nothing but a bony projection coming out of the bone, isn't it? That is called eminence. Yes. Now this is the superior aspect, or we can see upper view or superior view, or we can see this bone from above. We can see like this. Okay, yes. Now this upper end of the tibia is expanded to form a mass that projects medially, okay, and laterally and posteriorly beyond the shaft, and posteriorly beyond the shaft. When viewed from above, it is seen to consist of two parts called medial and lateral condyles. So this one is medial condyle and lateral condyle, and which are separated by an area called as intercondylar area. So this area is called as intercondylar area. And the anterior aspect of the upper end of the tibia is marked by another projection called as tibial tuberosity. Okay, so the upper surfaces of the medial and lateral condyles bear large slightly concave articular surfaces. So this blue color is the articular surfaces which articulates with the femoral condyles and which take part in the formation of knee joint. The medial articular surface is oval, okay, and is larger than the lateral condylar articular surface, and this lateral surface is somewhat rounded. Okay, the central parts of the articular surfaces are slightly concave. So this part is slightly concave because at this part this is somewhat thinner. Okay, and also slightly concave, which receives the femoral condyles here. The peripheral parts flatter. So normally the peripheral parts are flatter, and this will accommodate the menisci. So these areas are afterwards some accessory joint structures called as menisci are lodging this space to increase the joint congruence of the knee joint. Okay, now we'll move on to the intercondylar eminence. So this is the another part which we can see on the intercondylar area. Okay, this eminence is the articular surfaces are separated by the intercondylar area, which is non-articular. The intercondylar area is raised in its central part and constitute the medial and lateral intercondylar tubercles. So on the medial side, so you can find like this. So like this the eminence are present. On the medial side we can call it as medial intercondylar tubercle. On the lateral side we can call it as lateral intercondylar eminence. Okay. So next, the medial and lateral parts of the intercondylar tubercle are more prominent than its central part and constitute the medial and lateral intercondylar tubercles. The medial and lateral condylar articular surfaces extends on the sides of intercondylar tubercles like this. The space, so it is going to increase. Okay, so this is about the upper end, and also in addition to its upper surface, the medial condyle has rough anterior, medial and posterior surface which are distinctly marked off from the shaft by a ridge. Okay, and the posterior surface of the medial condyle is marked by a groove. So that we can see on the medial side of the tibia. Okay, so we can, if you go to the anterior aspect, we can find such kind of things. Okay, here on the medial side you can find the medial condyle has a rough anterior, okay, and also medial and the posterior surface which are distinctly marked off from the shaft by a ridge. The posterior surface of the medial condyle is marked by a groove. So that one we can see on the posterior aspect. So this one is the posterior aspect. Here you can find the groove here. Okay, on the medial condylar side. Yes. Now, if you see the lateral condyle has similar anterior, lateral and posterior surfaces. Okay. The posterolateral part of the lateral condyle bears an oval articular facet for the upper end of the fibula. So here you can find this is the fibular facet which can be seen on the posterolateral aspect. Okay. Here the facet is directed backwards, downwards and laterally. So this is the features we can see on the posterior aspect of the tibia. Okay, now again we will see on the anterior aspect. The anterior surface of the medial and lateral condyles merge to form a large rough triangular area. The apex of this triangular is placed inferiorly and is raised to form the tibial tuberosity. So this one. Okay. And the tuberosity has an upper smooth part and lower rough part. The lateral margin of the triangle has a prominent impression. On the lateral side, it is having a prominent impression, which is also triangular. So this is all about the upper end of the tibia. Now we will move on to the shaft of the tibia. So here the shaft is triangular. It has an anterior, medial and lateral borders. That means it is having 3 borders. So one is anterior border. How many borders? 3 borders. Anterior, medial and lateral. Anterior, medial and lateral borders. And because of these 3 borders, it is consisting of 3 surfaces. So that one is medial surface, lateral surface and posterior surfaces. So now we will see the borders first and then we will move on to the surfaces next. Okay. In the shaft, so first we will see the anterior border now. This anterior border runs downwards from the tibial tuberosity. Its lower part turns medially and reaches to the anterior margin of the medial malleolus. Okay, this is the anterior border. Okay, next we will see the lateral border. This is also called as interosseous border, lateral border or interosseous border. So it begins a little below in front of the articular facet of the fibula. So it begins below and in front of the articular facet of the fibula. That means below the lateral condyle we can take this. Okay, and it descends along the lateral aspect of the shaft. It descends along the lateral aspect of the shaft. Its lower end forms the anterior margin of a rough triangle area which is seen on the lateral aspect of the lower end. That one we are going to see in the lower end. Okay, so this is the interosseous border or lateral border. Okay, now we will move on to the medial border. The upper end of the medial border. So the upper end of the medial border, okay, lies below the most medial part of the medial condyle. That means we can take this one. Okay, its lower end comes, so its lower ends come, okay, becomes continuous with the posterior margin of the medial malleolus. It will go posterior margin of the medial malleolus. So these are the 3 borders of the shaft of the tibia. Now we will see the surfaces now. So in between the anterior border and the medial side, so this surface becomes the medial surface. So the surface which is present between the anterior border and the medial border, that is called as medial surface. Now we will see the lateral surface. The lateral surface lies between the anterior border and the lateral border, then it is called as lateral surface. If you see the posterior border, so the posterior border is present between the medial border and the lateral border or interosseous border. This surface becomes the posterior surface. Okay, over the upper 1/3 of the shaft, this surface is marked by prominent ridge that runs downward and medially across it. So this one, this area, okay, and this ridge is called as, soleal line. The part of the posterior surface above the soleal line is triangular. Okay, this part below the soleal line is divided into again medial and lateral parts. Okay, the lower part is divided into medial, this side is medial and this one is lateral parts. Okay, here a faint vertical ridge is present, and at the upper end of this ridge here you can find nutrient foramen of the bone. So these are the features which we can see on the posterior surface. Okay, now we will see the lower end of the tibia. Okay, now this is the lower end of the tibia. The lower end of tibia is much less expanded than the upper end. Its medial part shows a downward projection called as medial malleolus. The posterior aspect of the malleolus is marked by the prominent groove. Okay, and the lateral aspect of the lower end shows a triangular fibular notch for the articulation with the fibula. Okay, and it consists of an upper part that is rough. So the upper part is rough and lower part is that is smooth. The inferior surface of the lower end bears an articular area which articulates with the upper surface of the talus to form ankle joint. That one we can see in the lower end of the tibia. Okay, yes. So here on the medial side you can find this fibular notch. Okay, and also we can find the posterior surface and lateral surface, posterior and lateral surface, and here you can medial side. So this is interosseous bone. This is all about the bony features and the external features of the tibia. In the next session we are going to discuss about the muscular attachments to the tibia and the ligamentous attachments. Thank you.